Good morning. Can you all hear me? Thank you all for coming today. We're really excited to tell you all about Help Me Grow. And for those of you out in the field in the district offices, if you could just all mute your mics now, and when it's time to unmute at the end, we'll have time for questions and answers. You can press *6. And if everybody could be sure they sign in on the sign-in sheets on either side of the room, that would be great. And we also put lots of materials out on the tables for folks here in the room. And other folks, you will be able to access a lot of the resources we have here in paper copy by looking at our new website. We're going to tell you all about that, helpmegrowbt.org. Check it out. It is formatted for mobile devices, so feel free to look at your phones during this presentation as long as you're checking out our website. All right. So good morning. I'm Janet Kilburn, Child Development Coordinator here at the Health Department. Pleased to see you all. And I want to introduce my two colleagues who are going to help me share today all about Help Me Grow. Dr. Barb Frankowski here in front row. She is a practicing pediatrician at the University of Vermont Children's Medical Center and Pediatric. And then she's also a faculty at VCHIP, Vermont Child Health Improvement Program. And my other colleague, Elizabeth Gilman, she's a Help Me Grow Child Development Specialist. And Elizabeth comes to us with a background in psychology and over 22 years of direct service work in the field, on the ground, in the trenches, literally. She's done street outreach work with homeless populations, served really vulnerable kids and families with emotional and mental health issues as well as health care needs, really focusing on the most needy in Vermont for years, serving in lots of capacities, substance abuse work. So we're really thrilled to have her as our child development specialist at Help Me Grow. All right. So Help Me Grow, addressing social determinants of health by linking families to resources and building resiliency. Today we're going to talk a little bit about how we do that, how we promote resiliency and family well-being by linking families to basic need resources and other formal services. We're going to talk about Help Me Grow can strengthen families through the work that you're doing, how you can use it as a resource in your own programs and agencies and your direct service work out in the field. And then we're going to give you a sneak peek at our new Universal Developmental Screening Registry. So I'm going to just start by reading this quote from Nicholas Kristof from the New York Times, "The Way to Beat Poverty." I'm starting with this because it really sums up what Help Me Grow is all about and what we're trying to do. One of the reasons the United States has not made more progress against poverty is that our interventions come too late. If there's one overarching lesson from the past few decades of research about how to break the cycle of poverty, it's the power of parenting and of intervening early, ideally in the first year or two of life or even before the child is born. So that's what we're going to talk about today, is how do we do that. This slide is from Neil Halfon. He's a real famous guy in public health. Some of you have probably heard of him. He's at UCLA. I have to give him credit. And I'm going to just start by explaining on the left-hand side here, you see, can folks still hear me? I want to make sure this works. You can see this ready to learn. So this slide is illustrating a preventative approach to school readiness. And this is the ready to learn axis. Then you have a chronological axis on the bottom. And you see as kids develop, they have what we call a developmental trajectory. And most kids are on this white trajectory, a typical development healthy trajectory. And then in any population, there's what we call a delayed trajectory. Kids with delays and disorders are born with a chromosomal condition or genetic disorder, and they're on their own trajectory. And this is nationally about 1 in 6 kids. Varies from state to state, anywhere from 5 to 45% of the population. And then you have this middle trajectory at risk. And the national statistics around this are 1 in 4 children has a social, emotional, behavioral, or developmental delay. So we want at Help Me Grow to not just focus on this delayed disorder trajectory, because we do a really great job with that. We really want to focus on preventing kids from falling off this healthy trajectory, really moving the needle on that 1 in 4. Anybody hear the recent VPR podcast on how Vermont has the highest rate of kids with social emotional disturbance is labeled. But so this has huge cost benefits to our society if we're able to intervene early with things like parent education and supporting the emotional health of a new parent, of a new mom, or a pregnant mom, right? If we can shore up and create a protective home environment through home visiting. We have wonderful home visiting, evidence-based home visiting in Vermont. And Nurse Family Partnership, our own program, maternal child health, starts prenatally. Of course, a high-quality medical home, and in Vermont, we do a great job with that. 99%, I think, of kids are connected to a medical home. And then quality early learning and development programs. So the child care plays a huge protective factor. It's a wonderful intervention, particularly for kids whose families are really struggling to make ends meet, or kids where there's not enough food, and housing insecurity, domestic violence, and trauma. These are all things we're trying to address at the community level, and they're all things that impact, of course, children's health, but ultimately children's development. So if we are able to intervene early, those cost savings to society. Oh, can everybody still hear me? I'm going to talk a little louder. If we are able to intervene early, the cost savings to society, and we're talking about economic, social, and academic savings. So kids who get help early are much more likely to stay in school and graduate, not get pregnant, not end up in jail, really flourish in their lives. And the savings are $30,000 to $100,000 per child that we're going to save. So we're paying for a lot of those kids now that we didn't and that we aren't catching at that really early critical age. Okay. And of course, neighborhood safety and support. So the newly released American Academy Bright Futures Guidelines 4th edition is out, and there is a great focus on social determinants of health. So those household hardships that we're talking about affect children's long-term healthy development and their long-term health outcomes and even their genetics. So we need to look at the family, the extended family, the community, the society, and the culture that kids are raised in, because all these factors affect them. And then pediatricians are given guidance in these new guidelines around using strengths-based approaches. And a very exciting feature of the guidelines is that pediatricians have a new recommendation around surveillance, which is just monitoring children, monitoring their development, is that they incorporate the observations of early childhood professionals in the community providers, so child care providers, home visitors, early interventionists, nurses, that they're really supposed to take their observations and their concerns and incorporate it into their own medical home work. We're really excited about that at Help Me Grow because that directly supports the work that we're doing around promoting cross-sector collaboration and communication and our new registry. Okay, so why Help Me Grow Vermont? Again, these are our basic assumptions that there are still kids out there that we're missing, that there are lots of great things and great programs that we do in Vermont, but it can be challenging to connect kids and families to all these array of services, and that children really need this coordinated cross-sector approach. You can't implement and find those kids just out of the health department alone. We really need education. We need Department of Children and Families. We need nurses, family support, child care providers, everybody working together in a coordinated effort. Okay, so what is Help Me Grow? Help Me Grow is all about improving access. We are a statewide system, not a program. We are that cross-sector integrated system that's trying to expand access for the whole population to services and resources in the local community so that we pass that wide safety net. And we're about making connections, supporting really robust connections. Connections sometimes is hard to reach and difficult to engage families. And we're trying to be very proactive by connecting families to high-quality parent education resources, answering their questions over the phone about their child's behavior and development so that we connect them and engage them as soon as possible in what our state has to offer. All right, so our system, it's a requirement that we have 4 components. These components are interdependent, but they're required by all Help Me Grow states. And there's over 25 states now across the nation. And lots of states like California are implementing county by county because they're so large, so there's 51 systems, as you would say. So many folks are really finding that this cross-sector approach with 4 required components is working. So the first is a centralized telephone access point, family and community outreach that's on the ground in communities in our rural regions to really engage the whole population, all families with young children. Child health provider outreach, really key, so that medical home becomes that place that holds all the information so that during well child visits, they know what the child and what's happening and who's serving that child and family. And then, of course, data collection and analysis for continuous system improvement, so we know how we're doing. So we're going to start talking first about centralized telephone access point. And this is to connect children and their families to services and ongoing telephone care coordination. We're really trying to supplement the care coordination that a medical home might provide, that a home visitor would provide, that Children's Integrated Services programs provide. We're trying to fill gaps and really support their work by having this, ready to answer from 9 to 6, Monday through Friday, and engage and support the system that already exists and the programs parents and families may already be connected to, as well as engage them and connect them if they're not. Okay, just to another mention here, the American Academy of Pediatrics released a policy statement and a policy brief in 2016 that really talked about the pervasive threat that poverty poses to children's health and development. It advocated that pediatricians support and work to support state and federal programs that help families most in need, and 2 resources that they recommended that pediatricians use are 211 and Help Me Grow, and we're lucky enough to have both in our state. 211 is a free information and referral resource connecting families to all kinds of human services and resources, and you're hearing all about Help Me Grow. So now my colleague Elizabeth is going to come up and tell you a little bit more in-depthly about 211 and Help Me Grow and how they partner.
Thank you, Janet. Janet, do I move this way to go forward? Okay. All right. Thank you for having us here today. So as Janet mentioned, I'm a child development specialist at the Centralized Access Point or Contact Center for Help Me Grow. And she also mentioned we're there Monday through Friday from 9 to 6. And we work in partnership with Vermont 211. So sometimes people get confused about that. They think we are 211. A way to think about it is we're really a specific, separate early childhood specialized unit within Vermont 211. And because of our partnership with them, we're able to access their database and use it. It's up to date. It provides a lot of information and services in the state of Vermont. In their database, there's over 1,000 agencies, and within those agencies, there's almost 3,000 programs and services. So it really opens up the door for us to be able to really assist families and children in connecting to the most appropriate and most accurate information on services to help support them. Information referral has a set of national standards, and the database follows that. And because of our partnership, Help Me Grow child development specialists like me and my coworker Megan are certified in information and referral. And so it really helps us in regards to helping families navigate systems and services for them. Oftentimes when families call, sometimes they don't really know where to start, or maybe they've already made about a dozen calls to different programs trying to figure out if it's appropriate for them, if they're at the right place, and we can really help them do that in a very easy, simplified way and have conversations with them about what it is that they're really trying to find and what would be the best situation for them in terms of services. We can also help medical providers and other community service providers with that as well. They really need to maximize their time with families. A lot of, especially medical providers, don't have a lot of time in the office with families. And so by referring to Help Me Grow, we can really have those in-depth conversations and really help direct that family to the most appropriate place for them without kind of using up that office time when they need to be addressing the health issues that's going on for the children that they're serving. We also offer confidential voicemail, so when we're not in the office, families can leave a message for us that we can follow up with the following day. And in that partnership with 211, because Vermont 211 is 24 hours a day, every single day of the year, if a family does call and they don't hit the extension for Help Me Grow and they speak with a 211 information and referral specialist, they can assess them for the immediate need that might be going on. If it's something like in the need of shelter at night, or if they need emergency furnace repair in the wintertime, or a domestic violence agency, they'll help them with that really important need that they have in the moment, and then pass them along to Help Me Grow, where they can leave a message and we can follow up with them the following day. So it's kind of a safety net being connected to 211 so that families have that 24-hour access and then that more in-depth follow-up with a child development specialist. If I can do this. So that being said, Help Me Grow and 211 have always done some informal assessments around social determinants of health. When a family calls, we talk about their source of income, we talk about the presenting need that they have, and who's in the household and what the situation is. And in June, Help Me Grow started using the 2-question standardized tool developed by Children's Health Watch, the Hunger Vital Sign, and it's specific around food insecurity. So in our calls, we've really started tracking that and connecting families to food resources and making sure that those families were not going without. And we do that in, it sounds like a really formalized way because it's an assessment tool, but we do that in a really natural way in our conversations with families, like we do when we're talking about any social determinant of health, like is there violence in the family, or is their housing stable? A good example would be a family might call and say that they're having trouble affording child care, and if they're not able to afford child care, they won't be able to stay employed. In that conversation, right there is the red flag that there's a financial stress in the family. So it really opens that door to talking about other needs that might be going on. You mentioned that you are struggling with child care. What else is going on? What's your income? Do you have enough food? Have you ever worried that you don't have enough food? Is your housing stable? Are you behind on your rent? And really having those questions at that moment before waiting for the family to identify that they're in crisis helps us prevent them from things like eviction, having their electricity disconnected, losing their employment because of not having child care. It really helps us have that conversation, as Janet mentioned, ahead of time to kind of do some preventative work with that family and do those follow-ups and support and helping them navigate those systems so that their family is feeling more supported. So this kind of gives you some information about what our referrals were in 2017. In 2017, we referred to over 1,000 agencies. And as you can see, some of the top categories are probably not too surprising to folks. Individual and family wellness, that's really about play groups and support groups. It's about social connections for families, for feeling like they understand their child's development. And basic needs, of course, is the big one. And that's where those more concrete social determinants of health come in. Food, housing, utilities, transportation, especially in some regions of Vermont that are more rural, is a big issue for families in getting the services. And so I think also these are on the handout as well, Janet. So she left some on the table, and of course those who are tuning in remotely, we could certainly get those materials to folks. Janet's holding it up. So we can't really talk about social determinants of health if we're not talking about the protective factors framework. Hopefully, I don't know if everyone is familiar with the protective factors and what that framework is. For those of you who aren't, there are 5 factors that really support family and children's well-being. And when you strengthen these 5 factors, you support that family, you make them stronger, you make them more capable of moving forward in life and their health and well-being. The 5 factors, as a quick review, are parent resiliency, social connections, knowledge of parenting and child development, and concrete support in times of need, and the social and emotional competence of children, which is something that Janet mentioned before in the NPR podcast. So when we help parents and families strengthen these 5 factors, it really not only supports that family, but it also reduces child abuse and neglect. We were really fortunate in 2016 to do a 8-month pilot with Help Me Grow National Center and the Center for the Study of Social Policy. And in that pilot that we did, our biggest success was that we discovered that when we had a general population of callers who we were not really mindfully and in a real trackable way helping that family with certain protective factors, 36% of the general population was getting connected to the services we were referring them to. When we did use the measures that we put in place in the pilot to help connect them, 52% were able to connect to those services. This is really about having conversations with family. Who's a good, safe, solid support for you? Who do you talk to in times of need? Are you aware of these programs that are in your community that are designed to help you? How are you going to access those services? What are the barriers to those services? Do you understand the stage that your child's at when you're under financial stress? Are you able to still parent in a nurturing, helpful way, mindful way, when you don't know if you're going to have enough money for rent? And it's really trying to get at bolstering that up, because once that family is getting services and is getting their needs met, you want them to continue that path that they've started on in really supporting their children and really knowing what it is that their children need and how they're going to mobilize their resources should the crisis or another issue come up in the future. And I guess a good call example, just a quick example that kind of shows that connection between the social determinants of health and the protective factors is, we received a call from a medical provider, or a referral from a medical provider who was working with a single mom of a toddler. Toddlers are tough. They have tantrums. They have big feelings and few words. And the mom was expressing that she just didn't know how to deal with that 2-year-old when she was having a meltdown. In talking to that mom, we talked about that and talked about getting some support and parenting skills classes at the local parent-child center. But in that conversation, she was talking about how she was struggling financially. And that was really playing into her having the patience and the energy to deal with her daughter when her daughter was having a tough time. And so we talked about how getting those skills is great, but getting that parent support is crucial to being able to use those skills. So we talked about what a parent support group could do for her, connecting with other moms, talking with other moms, and also being able to give back to other moms in the things that she's known and learned. And then we talked about those financial supports and what are those barriers to getting there. Are you able to get all of the benefits that you qualify for? What do you qualify for? What are you willing to apply for? And how can I make that easier for you? And then in the follow-up calls, finding out, did you connect? Do you want to keep trying? How can I help you do that? Did you know you can apply online? You don't have to go in person if that's a struggle for you with transportation. So it's about really connecting those two things and using family-friendly language. We don't want to use jargon and we want it to be really understandable for parents. We're not going to say things like, you need to learn about social and emotional competency. Most families aren't going to understand what that means, but we can say 2-year-olds have a lot of feelings and they don't have a lot of words to express them. That must be really frustrating when that happens. You can't get your needs met. So here's some suggestions on how you could do that, So we really want to make sure that they are connecting. Now, the reality is sometimes when you're talking about social determinants of health and you're talking about family needs, there aren't always resources to help that person. I think a great example is housing. We, I think, can all acknowledge that we have a housing crisis in Vermont and many parts of the country. So when a family calls and they're facing homelessness, Help Me Grow does not have housing that we can just materialize for a family to move into. But what we can do is talk to them about, are you on all of the subsidized waiting lists? Do you know about any family shelters around the state that you might be able to go to? When a family has done all of these things, we want to support that family while they work through it. Maybe they don't know about the homeless liaison through the Agency of Education. Maybe they need to think about other ways that they could help save their money. Maybe they need to think about who is a good support, who's going to let them stay in a safe, stable place until they can get to that place where they're in their own housing. So I think the next piece is Barb is going to talk a little bit about
For me,
child
I'll
health
do a
provider
couple
outreach.
slides.
Yeah.
And Barb will. Thank you.
I think this is all I need.
All right, thank you, Elizabeth. And so we're going to touch on child health provider outreach next. And that is really to support developmental promotion, early detection, and intervention. This is a really important slide that illustrates that key component of what a Help Me Grow child development specialist offers is this robust feedback loop. National research tells us it takes on average 7 tries, 7 calls for a family to get connected to one service. That's a lot of time on the phone, and a lot of our service providers and communities are spending a lot of time connecting families to resources. So we have 2 child development specialists just sitting by the phone waiting for your call because they have the capacity to offer this ongoing feedback loop. They call back, they can text, we have 2-way texting, they can continue to try to contact and follow up with the family and with the services. The family's on a wait list or the service hasn't started, to make sure the connection happens. So for instance, you have a well child visit, the child comes in, the healthcare provider solicits a parent concern or a need, they refer to Help Me Grow, and we contact the family, we connect the family to the resource, and if that takes 6 months, that's fine. We will probably connect them to other resources as well in that time and build that relationship, but we will continue to follow up with the referring provider with family permission. We always ask the family if we have permission to contact the child's health care provider because we know the medical home needs to be in the loop, as well as any community provider that refers. And so then the provider and the doc get the feedback, and everybody's on the same page. We all are together from our different places of working with that family to know the big picture, what the family's getting and who's in the home. We'll give some more stories a little bit later to illustrate that robust feedback loop. I would just say we're partnering closely with a lot of programs. The WIC nutritionist sees the family, they elicit a concern, they refer, and we get back to WIC and let them know that piece of work that we did, whether it's working on an insurance issue, connecting to a basic need, or referring to a more formalized service like Children's Integrated Services. Children's Integrated Service workers are doing the same thing. Coordinators are great. Our job is to really refer to that formalized service. That's where early intervention is. But they're also partnering with us to make sure that children, and particularly families that sometimes get referred, but then that connection doesn't happen. They go to the next well child visit. The early intervention still hasn't happened because the family cell phone got cut off. They're homeless, they moved, and it's just tricky. We really want to support those programs and providers and offer that extra effort to keep that family connected. So I'm going to tell you a couple ways you can refer. This is option 1. We have our magnets on the table, and you can give a family a magnet and say, hey, why don't you call Help Me Grow? They could help you with this. We also have texting, 2-way texting. We can text back, and then there's our website information on there. So the message is learn, talk, and text. You can refer the family to the website just to learn a little more about how do you support a child's social skills. How do you help that 3-year-old with taking turns? Boy, that is really tough. We have some great, quick information on our site for families as well as general development so that a family knows what to expect. It's easier to parent when you know what's coming and what's typical development that you're not expecting too much from that 2-year-old. Option 2 is you can formally refer, and you can use our referral form. It's on the tables. We have an online form on our website. You can see right here it's downloadable, that little purple box. You can download the form and fax it. And these are some of the basic kind of most things that we get referrals for. So you can just check off community resources, basic needs, parent support, connection to local developmental play groups, library story hour, extracurricular activities, free rec programs in your region, childcare, Head Start, preschool, specialized service like Children's Integrated Services, information on pregnancy and parenting, and then we have tools, lots of tools on our tables for parents and caregivers to track developmental milestones. So those are an education in themselves, all about child development and what to expect. And again, just to emphasize that we will confirm with that referring provider, and we always ask for family permission to get back to the referring provider and let them know what the family was connected to, as well as the child's health care provider.
Sure. So I just wanted to, hi, thanks for coming, you folks. So I just wanted to give a little example of what it looks like in the provider's office and what I'm working with as a primary care provider when I see these kids. So one example, we just sort of picked the 4-month checkup as a touch point. And what you can see there, this is the Bright Futures, in that Bright Futures book, these are the priorities for the visit, for the 4-month visit, and you can see that social determinants of health is right up there at the top. So figuring out what's going on, in the big picture for this family, not just the mother and the little baby, right there in front of you in the room, but what's going on in their life. And then obviously all the other things that we check in on, the baby's behavior development, oral health, nutrition and feeding, safety, so all the things that we go over with that family. But very excitingly, we have a project going on now in the state where practices, pediatric and family medicine practices that are part of the CHAMP network with FECHIP, which work on a particular quality improvement project every year, are focusing on how to ask those social determinant of health questions in your medical office in a formal way, so you're not missing that information. So we have all those other things that we're focusing on also, like that we've always done, but now we're trying to ask these questions also. And not every pediatric and family medicine office is doing it. A lot of the offices are struggling with how to work this into their flow, but there's about 30 practices across the state that are actively working on this right now, which is really exciting. And depending on, we're really focusing on food insecurity, the bottom 2 questions, but the suggestion also is to be asking about housing. So, for example, my office, University Pediatrics here in Burlington, we're asking about housing instability, food insecurity, and child care, family relationships and support, and then we're also doing universal screening for maternal depression. And so we get that information. So going back to this mother, this little baby, other than being kind of congested, I find out that the baby is developing fine. Mom feels comfortable in her role as a new mother, meeting the needs of this baby. She's a little bit frustrated because the baby seems just congested all the time, so is not sleeping really well at night. But then when I look at her answers to these other questions, I find out that she has stable housing, but that's because she's living with her grandparents. She doesn't get along with her own mother, so she's living with her grandparents. Her grandfather smokes. He's not about to stop. That's not on his bucket list, his personal bucket list. And so, and she knows she's read about the effects of, cigarette smoking on babies, and so she suspects that because the baby's not in childcare, that the congestion and the fussiness at night is due to the constant smoke exposure. So she, what she really would like to do is find alternative housing, but she's home with the baby now. She's not, she's not working, and she doesn't know what her options are. So me, in my practice, I'm lucky enough to have 2 options, because we have, through the Blueprint and Medical Home, we have the community health team, and we have a social worker on that community health team that I can refer that baby to. But guess what? Right now, I'm making this up, but it happened in the past, our social worker is on maternity leave. And so we're using the social worker from the adult community health team, stretched really thin, and I think this mom is really together. So I'm going to make a referral for her to help me grow to see if we can help meet those needs. And I could either hand her the magnet and tell her to call, but that doesn't feel to me as her pediatrician like a really warm handoff. And she may or may not make that call. So now what I would do is I would fill out that referral form and fax it in. I would let her know that I'm filling this out. I would let her know what information I'm putting on it, because that's her priority of what she wants to do. And then Elizabeth would get that. So I don't know if you want to say anything else about how you would handle a call like that from a mom.
Getting really real now.
Right, yes.
This is what I do every day.
A composite story
Yeah.
of many patients of mine.
Yeah, it feels like maybe I took this call. I probably have. Yeah, so we would get that referral, say from Barb, and in reaching the mom would have the conversation about what Barb checked off, but also more. So you're looking for stable housing, and what are some of the barriers that are coming up? Have that conversation. It might be that, well, I really need to find some quality childcare so that, I can start working on the housing piece. So we would talk about the ways in which she could access a local childcare referral agency, and we would talk about childcare subsidy in Vermont and how do you apply, how are the ways you can apply, and then talk about, for housing you got to have income. Are you working? Is that your plan? Are you receiving reach up? Do you know how to apply for reach up? Do you know the appeal process if you're denied for reach up? Are you working with Voc Rehab? We would have that conversation about those financial building blocks to be able to move on. And then we all know that housing lists in Vermont are extremely long, so have you already put all your irons in the fire? Have you applied? Are you on all of the waiting lists that you could be on? Really having that, starting from the ground floor conversation about how can we get you to a place where you can move out of your grandparents' house, and do you have other supports besides your grandparents? I know parents aren't a support for you. Do you have friends that can help support you in this process? They can get you to the Economic Services Office if you don't have transportation. And then, as Janet mentioned, we would have that follow-up. We would ask permission to call Barb back. We'd let her know what we talked about. And we would keep working with that family until they felt like they were really on the right track or already connected or really felt like they were in the place where they can move forward. A good point to make is sometimes we give parents information or guardians information, and we make a few follow-up calls, and they say, you know what, I really got this. I know what I got to do now. Thanks. I can do this. That's great. Then we would let them run with that. We might never hear from them again. Or we might get a call from them 2 months later, and it's not even about any of those things. It's about something else that happened. And because that they know that we've had this conversation in the past, we've built that relationship with them, and they can call us and either just problem solve or get new resources, and just kind of have that ongoing relationship with families. So I wanted to stress that sometimes it is a one-time shot with families. And if that's what that family needs, then great. But oftentimes it is a process, and it takes a lot of time. I've been with Help Me Grow for almost 3 years since the call center started, and I still have families that call me every once in a while that were some of the first families that I spoke with when I started in this role. And they sometimes call just to problem solve. That's important for families, because if you think back to the protective factors, who's the concrete support in time of need, or who's going to help you make those connections? And that's really something that myself and my coworker can do for families.
All right, just want to put a shout out to the field. Our MCH coordinators are doing a fantastic job doing child health provider outreach for us around Help Me Grow. This is just some preliminary data. They started in October, really focusing on going to healthcare providers, medical homes, taking our Help Me Grow magnets and our resources for families and really informing them about Help Me Grow as a resource, certainly a resource for around screening for social determinants. And look at what they've done so far. They've done 99 trainings on Help Me Grow referral and linkage since October, and that was over the holiday period. Pretty astounding. And we've reached 266 medical professionals, and they've trained community providers as well. That wasn't even supposed to be the first part of the workload, and they just took it on and are talking to everybody. And we're really grateful. Thank you to all of you out there. It's just fantastic work, and the data really reflects that. I want to just quickly show you some of our resources. We have a lot of them on the tables here, but these are on our website. And there's some videos. We have these Milestone Moments booklets, which are great to give to families, but the CDC has put them into videos, which are on our website. And we're going to see if we can watch one right now. This one does not have any sound. This is a 1-year-old has favorite people. She is so cute. All right, and this is a 2-year-old showing some defiant behavior, and which is very typical, as we know. Not going to wash those hands. Okay. Okay, and then I want to point out, if you go to the App Store, you can download this free CDC's free Milestone Tracker app, which is basically that booklet in an app form, which is perfect for today's parents. And it's really cool. It has interactive milestone checklists. You can put more than one child in there. If you're a child care provider, you can put all the kids in your home that you're caring for or in your classroom. And you can email the results to grandparents, family members, and to even your child's doctor. And they have it in Spanish and English. It's just a really cool tool. I encourage you to check it out. Okay, so family and community outreach. Barb, do you want to say a couple words about this?
Sure, thanks. And this is another really exciting program that we have that's been going on for the last over a year now in Vermont, which is reaching out to early care and education providers throughout the state, making sure that they're aware of Help Me Grow, making sure that they have materials that they can give out to parents and that parents know what the referral process is, but also engaging them in developmental screening. So there have been 2 wonderful women who've gone throughout the state to teach the child care providers in each of the health service areas around the state about how to do the ages and stages screening in their child care setting. And it's been really exciting. I've had the opportunity to attend some of the training sessions, and it's very intense but very supportive because there's an all-day learning session where they are introduced to they learn about Help Me Grow, and then they're introduced to the Ages and Stages questionnaire tool and how to do that. But then that's just the tip of the iceberg. Then there's intensive one-on-one coaching sessions that are done with each of the child care centers or home providers where they sort of figure out how to incorporate the ages and stages screening into their own child care center. What's going to work best? Are they going to do all the kids once a year? Are they going to do the kids right before they do parent-teacher conference? And so getting that individual support to do that. And then, I should have done this. So this is what we've done. And I wanted to give a shout out. The money to make this happen has come from a permanent fund, Birth to 5, and the launch grant that we've been using to actually pay for these people to go drag themselves around the state and do all this. And here's what it looks like around the state. We started out with Chittenden County. That's the 148 child care, early education and care providers who have been trained to do this. And then you can see the other health service areas. And I'm going to say that one that's the 0 in the Middlebury area, that just popped up to almost 40 people who got trained just this past Saturday. So the training isn't complete because it's the 9-month coaching period too. But it's very exciting to have that happen. And we're going to talk about the registry in a minute. But the thing that's really exciting is that as these ECE providers become comfortable with doing the screening, using it in their setting, whatever works for them. It's made the parents, what we've heard back from parents is that it's made the parent-teacher conference much more interesting and exciting, because even if their kid is doing well, that's a celebration. You know, we did this formal testing on your child, and look at that, this is wonderful, look at all the things they can do, and then they can pick up things early and refer either to Help Me Grow or tell them to go back to their medical home and talk about it some more. And now we're going to have those ECE providers entering those ages and stages results into the registry. We've started to link providers, healthcare providers, with the registry also. So we have, across the state, we have 5 healthcare providers who are piloting the registry, and we have more who are interested, who are going to be coming down the pike doing that. So that's really exciting to see that happening.
Okay. And I just want to add to what Barb just said, early intervention has gone up around the state. The recently retired Children's Integrated Service Director, Terry Egerton, credited Help Me Grow with that improved rates of catching kids early. The age of referral was 26 months in 2013. It's gone down to 18 months. The kids get referred to early intervention, so that's about an average of 5 months longer kids are getting services at an earlier age. So we're really excited about that data. And now our data collection and analysis. We collect data across all 4 components. You can see our RBA report card, and it's also on our website. And just a quick sneak peek at our registry, which we're so excited about. Shout out to Julie Maslick and Jan Fortune, who are in the room, who worked really hard to get this registry from the IT part and all the way to implementation, get it off the ground. And the message here is there's no wrong door for developmental screening. Really, that we're screening across all kinds of programs and all kinds of settings, and we want that information to be able to be shared in an easy way, and for folks to not have to duplicate, and the family not to get screened at their home visit last week and then go to their well child visit and have to get screened again, but the providers can share that information seamlessly. So we now have 9 regions using the registry to communicate screening results. Here's a screenshot. If you go on our immunization registry, this is a summary of the child's screening history. So you can see there's several tools we have in here, the MChat, the ages and stages questionnaire, the ages and stages social emotional. And if you click on those details on the right, you can see a detailed ASQ summary sheet there. You can see the child's 5 domain score, if they're above the cutoff, if they passed the screening, who the screener was, which is really useful, and if a referral was made. This will inform our Healthy Vermonters 2030 data for the health department, and it's really a shared measure. Everybody's working on identifying kids early, and for lots of federal grants, you need accurate data around developmental screening rates, which now the registry will provide us with. It's just a summary of the developmental screening is that shared measure across education, family support, also accountable care organizations. It's a quality measure. And our efforts have really helped to strengthen the partnership between child care providers in particular and medical homes, which is really exciting. And we're kind of supporting that pediatrician's role with linking all these community providers to the medical home and optimizing children's school readiness. So we have some time for questions, and those of you in the field, if you'll press *6, you can unmute yourselves and ask questions. Question? Sure.
Yeah, so the child development.
Hello. So child development's a little new to me, so I'm just curious. I think I'm getting caught up in the jargon a little bit, and I'm curious how this relates to ACEs, and whether the protective factors framework, is it the same concept or?
It's a great question. And so ACEs are adverse childhood experiences, toxic stress trauma, that again pushes those children's developmental trajectories down. And so the strengthening families framework can directly address that as a framework. And it's really more of a strengths-based way to approach ACEs. Would either of you want to add anything?
Thanks. This whole linkage is very near and dear to my heart, because when you talk about ACEs, you're talking about an adult looking back at their childhood and what they remember. And I always say, as a pediatrician, I'm seeing these ACEs happening to kids in real life. I mean, we have kids who are born, they come out the birth canal, and they have what will be like 4 ACEs already, just coming out the birth canal. And so what do? You just throw up your hands and say, oh, that child is doomed, to have all these bad health outcomes. So that's why, from a pediatrician's point of view, we take the protective factors very seriously, because that's how, if you start with a family who's struggling right off the bat, that's what you can do to help that family. So giving those services early on helps to mitigate those ACEs. And if people are interested in that, there's also something called HOPE, Health Outcomes of Positive Experiences. And so that's what, when Janet showed that slide with the trajectory, those are all the things that are pushing the trajectory up, where the ACEs and the social determinants of health are pushing it down. So it's a balance between the two, and that's exactly where pediatricians live with these families. So thanks for asking that question.
I think it's also, the protective factors are a way to support and work with that family, that mom who may have multiple ACEs and may want to have some direct therapy, or so the support groups are really focused in on her own trauma and healing from that, but she's raising 2 children in the meantime, and she really needs support to how not, carry that ACE trauma in her parenting. And so Elizabeth and Megan are, trauma-informed, and a lot of training, and promoting those protective factors helps people heal from their ACE history as well. Other questions? Anyone out there in the district office? Oh, go ahead. We have another question here, and then we'll take some more.
Thanks. I'm just interested in the metrics and the logistics of the call center. How many people work there? How many referrals do you expect? Are you getting the number that you expect? How's the promotion effort going?
Great questions. On our data sheet, we have some of our, I think we have over 2,000 referrals we've made to date. And I need to look at the new data because we just got it yesterday. And we have 1,539 incoming calls. We make almost as many outgoing or follow-up calls, and that's really significant. We're constantly scheduling a time to call a family back and follow up. Why don't you try to work on that this morning? Would you be available around 4? I'll give you a call and see how it went later. So 1,237 outgoing calls. So we have 2 people answering the phone, and we still have capacity to take more calls, and we'd love to get more calls. So we're really hoping to get more formal referrals, faxed paper, or the online referral from providers. We get a lot of calls from families right now. We get calls sent over from 211, calls from child care providers, healthcare providers.
When we kind of look at the data, we've noticed that that collectively we're getting as many calls from families as we are from service providers. And we are seeing more and more educators that are contacting us, early childhood, but also school district staff as well, which we're really happy about. The referrals are a slow incline. We started that in the formal referrals started in this spring sometime. So it's nice to see that uptick. Certainly, Janet and Barb and others around the state who are in the MCH coordinators who are reaching out to providers we're seeing, that's making a difference in our referrals. One of the nice things about the referrals is that we kind of get all that information about the family right away, so that when we call the family, we have a real great stepping off point with them around who's in the household and what the need is.
And I think there's about 500 kids that we're actively performing that ongoing care coordination to, and that's a smaller number, but it's a very significant number, and that those are often the most needy families. Sometimes they're families that are hard to engage or don't want anything to do with a formalized service program. So I'm really proud of that number, and that's the service that we really provide the state with. That's that safety net. Also, we get lots of calls that are just anonymous, and they don't want to share a name. They don't want to get entered formally into our tracking system. So that is just the incoming calls, but sometimes that's just folks not wanting to really, be called back and leave a record, but they often do call back, and then formally we get more information to follow up. Other questions? Anybody out in the field?
Hi, this is Tanya from the Barry Local Office of Health, and we had a question about 211 and Help Me Grow, both actually, about how the database for local services is updated and how that happens.
Great question. So Vermont 211 has dedicated resource specialist staff. Their whole job is to do formalized updates on the database. So every single agency in that database is updated at a minimum of once a year, but oftentimes more often. And that happens from resource staff that are not only in the main 211 office, but they have folks around the state who are involved and embedded in their community and really collect that information and feed it back into the database. So it's kind of a living, ongoing, accurate organism that is really following those national standards. So because we're partnered with Vermont 211, we have access to their technology. And if you have questions about what's in the database, you can go to vermont211.org, I think it is, and you can actually go in and search the database yourself and kind of see what that looks like and see examples of the information that families and providers would get from us. Sometimes, we have the conversation on the phone, and so we give them that information on the phone, just like 211 does. And both 211 and Help Me Grow can also text that information to families, and they would actually get that full readout about that agency, who the contact is, where's the geographic area served, what's the eligibility criteria, and then we can also email that as well, as can Vermont 211. So that answers your question.
And we also get information from Building Bright Futures Early Childhood Advisory Councils. I have the councils in each region, and they're keeping us up to date right now about playgroups and local playgroups in each region, when they're held, where they're held, who comes. It's really a great resource for those more informal resources that may not be held within any agency. We're going to have to end in a minute. Any time for one more question? Anyone else? All right. Thank you all very much.